Good evening, everyone, and welcome to this edition of the Health and Wellness. My name is Nellie Greer, and I will be your host tonight. In tonight's program, we're going to talk about the red desert clay. The red desert clay is mined in Southern California, 20 miles from the Arizona border. It is said that the clay was discovered in 1897, and people then used it, but you know, it sort of faded with time, and people sort of forgot about it and didn't use it. In 1946, it came back, and they discovered it all over again, and they started to mine. And so now they're finding out since then, so it's been in the makings for about 200 years. And so the idea is that they have found that by consuming edible red clay, that there's a lot of different things that it'll help the body in healing. And we're going to be showing you pictures as to the different conditions of the skin that by taking the clay internal, you can assist. It is said that the intention of the red clay is to assist in removing toxins and pathogens from the body to help prevent the proliferation of pathogens, bacteria, and parasites, and to help build healthy tissues, remineralizing the cells and building bone strength. It is said too that a lot of times when folks consume a lot of calcium, and they often say, you know, I take a lot of calcium, but it doesn't seem like to do anything. I still have osteoporosis. And the idea is that if you know what a rock looks like when it's aged and it's porous and it's dry, that is how our bones look like when we have that condition. So the idea is what the clay does is by consuming it, it actually buffers and it cleanses the bones so that it now your bones can accept and take in the calcium. It is the clay that actually softens the bones and remineralizing them, and so that they're clean, so that they're able to take in the calcium. It says, considering the toxins in our environment, there is no way around avoiding them completely. We all have to breathe, which means we're taking in exhaust chemicals in the air, on our skin, and in our food, as well as pesticides, herbicides, pharmaceuticals, fumes, depleted uranium, pollutions from factories and water, to name a few. And it is said that these poisons can bioaccumulate in the body, which means they increase in their concentration over time, slowly contributing to chronic health issues, and then years later we receive a diagnosis. It is said that a ganglion cyst, when it develops in the body, it's oftentimes in a joint area. So it's either on your wrist, on your knuckles. It can be on fingers. It can also be on your knees, in back of your knees, on the side of your knee. It can also be on your toes. It can be on the ankle, on top of, but also on the top of the foot where the toe is. And it is said that injuries, after an injury, some people get them on their heads, some people get them on the forehead, some people get them on the chest. And I know because I have a customer that he's an elderly man, and he was a farmer for all his life, and he had a big growth here. And one of the things when I saw his shirt kind of went to the side, and I was able to see it, and it was just like a mass. And he said, oh, that was from an injury that I had in the farm. And, but I will say that depending on how many years, how new the ganglion cyst is, or how many years it's been there, it will heal accordingly, because if you assist with it fast or quickly upon getting it, then you'll heal quickly. However, if it's been there long, it'll start to become very hard, and then it'll start to grow bigger and bigger. It is said too that an acid condition, an acid diet, I know that there's a lot of folks that are very intolerant to wheat, but you don't realize that lentils also are very acidic, and a lot of people that become vegetarians, and they try to consume protein in other ways by eating too much of the same things, not knowing that they're intolerant to it, they will create a really acid condition. And I know because I had a gentleman that came in with cholesterol issues, and as we sat there, the wife kept saying, tell her, and or show her, and he wouldn't. And all of a sudden, we got talking further and further. I didn't know where this was going. But however, he then got comfortable enough, and he showed me his arm. Well, he showed me the wrist, and then all of a sudden he upped his arm, and he had bump. I mean, he had all these different bumps, and they were ganglion cysts. The ganglion cysts are very filled, soft. You can almost move them. You can move it back and forth, and you can press it, and you feel like if you press it down a lot, that it'll just kind of give. But it's solid there, and the only thing that is going to take care of it, a lot of times people say, well, go to the doctor, they'll lance it, remove that fluid. However, that's one way of doing it, but you'll find that if you don't change what it is that's causing that to happen, you'll continue to get it, and you'll always continue to fill that very one area, but not knowing exactly what they look like in other areas. You might have them in other areas and not know that that's what it is. You might think, I'm getting a little, fat in that area, but not so much. It's and it's usually in the ankles when the body starts to become too acidic. I have found that through the years, the more and more that we talk about the red desert clay, and the more I talk about the ganglion cysts, the more and more people come in. In the very beginning, I think people didn't come in because they didn't know what it was. It didn't bother them, so they figured it's okay. But when the ganglion sits in one area that's uncomfortable, or maybe like on the back, on your rear, and you're sitting, that is uncomfortable. And if it continues to grow, it actually makes your posture when you're sitting down to be compromised, because you feel like you have to sit on one side because that side hurts. So then you start compromising your spine. So the idea is that we're going to show you pictures of every one condition. Like the first picture that we have here is it's the wrist, and the ganglion cyst sits over here, and it's a big cyst that ganglion cyst that at first it's little, and then when they reimpose it, you can see it bigger. And that area is very common. It's a very common area to get. And the next one is in the back of the hand, and that's picture 6. And the other area, it's usually in this part here of the hand, and that's picture 3. And then when you turn your hand like that on picture 5, it's on this part here. So a lot of folks will get it in different areas. Picture 8, it's more rounded here. And that is usually the first sign of getting arthritis. And the reason why I say that is because ganglion cysts will develop in a body that's too acidic, number one, or maybe an injury, or maybe uses of using your hands a lot, or using your feet a lot, or athletes get it, and also gymnasts get it, and what's the other? anyone that works a certain group of muscles ongoing a lot, they tend to get these things. And a lot of times they think it on page, or rather picture 11, it's a foot and the toes, and they have it on the top of, it almost looks like a blister, but that's a ganglion cyst because it doesn't go away. And then it gets irritated when you put your shoe on. Also, ganglion cysts happen on the foot, on the outside where you have the ankle bone on the bottom, on your, and that's picture 16. And that part tends to get big also. And sometimes when women wear high heels, too big of a high heel, continuous on, those things will happen. And also on this part of the hand, on picture 12, that happens there. And it also happens on the ring finger. So it happens there. On picture 12, it happens there, and it happens here on the ring finger. Babies, adults, I've seen this where adults get it. A person that maybe bumped his head or something, or maybe fell off a swing. Children do this. And they end up getting a bump on their forehead. Picture 14, you can see a baby where the baby has a bump on the head. And untreated, left that way, the baby will never get rid of that. The baby will grow hair and everything, but on picture 14, that's the first stages, sometimes it just stays that way. So the idea is that these are pictures that you get to see as to all the different areas. Also on picture 2, it, I think that is, I think it's an elbow. It's either an elbow, yeah, it looks like an elbow. But anyway, but it also is found on the knee as well. And I think the more and more we talk about this, the more and more I've seen folks that come in and they will either up their arm or they'll say, is this a ganglion cyst? And some people get it on the eyelids. And the eyelids, it's almost like the first stages of it is, a lot of times it's like a sty. And untreated, do nothing with it, it'll continue. I usually say that I've talked about the sty, where you can put neutralizer and it'll dissolve it. However, in progression, where it continues and stuff, you got to take clay internal so that it assists in being able to take care of it. It is said that clay is, the red desert clay, it balances, it levels, it helps in stabilizing the potassium levels in the body. The clay also helps to strengthen the bones. It is said that the clay contains 55% naturally occurring silica, which actually is the seal that happens with the bones. It actually helps your teeth, your bones, makes them strong. It's what finishes and it strengthens the bones and teeth, which helps move calcium into the bone cell, along with a boron, manganese, and iron, and calcium, and magnesium. Clay is, it is said that the clay particles are so tiny, they are, the clay is like a 3.3 micron of clusters that or particles that are really small, and they penetrate the blood, and in doing so, what it does, it's able to cleanse the blood and killing all the bacteria. So much so that it is said that the hair, the clay is 3.3 microns, and the hair, in comparison, and the hair is 50 to 75 micron in diameter. So you figure how small in particles that clay is. And that's the reason why it is said that the clay carries a high negative charge, And when our bodies are acidic, when they are toxic, when we're housing chemicals and herbicides and just pollutants and all things in our bodies, heavy metals and mercury and the clay that's positive. The clay has a negative charge and it acts like a little magnet, and it actually picks up all the bad, and your body then removes it. It is said that the clay, there was a study done in Arizona, in Arizona State University. It is said that it's one of the clays that actually kills MRSA, and it also kills tuberculosis, they said, and also leprosy. And whoever wants to see this article, it's right here. It's and it is said that in the findings was that they worked with it, and those were, in taking that, the clay, it helps in working with that, because anytime you have a condition, and if you do it quickly upon being diagnosed, well then of course your body works it through and you start to cleanse and detoxifying. However, the longer you have a certain condition, know that you're always healing backwards, so it's going to take longer. However, I always tell folks that whenever you have and get diagnosed with something, usually you go to the doctor, and that's a good thing to do. However, it's always good to implement something that's holistic also, because that way there you help your immune system and you help your body to continue to heal in that aspect or in that way. And then of course you use more harsh methods. The doctors use more harsh methods in dealing with whatever it is, but it's always good to back it up with something that is less, so that you're working with the body and helping the immune system to stay healthy, to be able to, so that when you stop doing this, the other part takes over. It is said that that the clay is, although we cannot avoid all toxins, it says the red clay will help reduce the toxic burden and supply minerals to nourish our cells. It says, remember, cells are the building blocks of your body. If your cells are healthy, you are healthy. And also, we use the clay for periodontal. So anyone that has pockets in their teeth, if they have receding gum line, if their gums are bleeding, if whatever's going on in the mouth. A lot of times if you have thrush, if you have an acidic condition, the clay will actually make the condition less. It'll start to heal. The clay gets into those little pockets, and after you floss, after you brush your teeth and you floss, you actually then take the clay and you just wet, the brush is wet, the toothbrush, and then you just use the powder, the clay, and then rebrush again so that the particles stay and remain in those little areas, and then you rinse and you go to bed. It's good to do it in the morning, and it's good to do it at night. It is said that the clay, what you do is, when you take it, for anyone that is going through cancer treatments or radiation, it is said that you need to wait like 6 to 8 months until all the treatments are finished, and wait that length of time, because if you take the clay while you're doing the treatments, it'll cancel it out. So a lot of times it is said not to take it within the time or while you're doing it. You have to wait, because even though the treatments have stopped, the whatever was done is still working throughout the body and assisting. So you don't want to cancel that out. You want to get the full benefits of that. And then once that's all done, 6 to 8 months later, you can start, so that you remove all the chemicals and all the toxins that were left behind. So the idea is that the clay can be used that way. It is also said that if you're taking medication and you're doing clay for maybe candida purposes, and candida, clay is very good for candida, and I've got a lot of testimonies on that, and I'll talk as I'll tell you as I go along. But the candida, it is said that for anyone that has candida like rosacea, or if they have skin disorders. I know I had a lady that came in and she was scratching her head, scratching her face, scratching everywhere, and she just would talk, but she just kept busy scratching. And she went home and started doing the clay. And I will tell you that it didn't happen, for her, it didn't happen right away. However, she started to understand what was going on, and she continued to do it and started to applying it on the skin. When you apply it on the skin, what you want to do is you want to mix some of the clay with some maybe neutralizer, liquid that we have in our center that's mineral based, and you make a little paste, and then what you do is you want to lay a gauze on the skin that you're trying to work with. And once the gauze is on there, you put the clay on there and let it kind of really soak in really good. And then what you do is you put another gauze over it and just let it sit there long enough for it to dry. And within time, as it continues to dry on the skin, you can remove it, and when you rinse it, you will see how smooth that part of the skin, how it'll start to heal. And it is said that even after you do it only one time, you will go about and not do it, and it'll continue to heal that the skin. It is also said that MRSA is one of the bacteria that it's called. MRSA is sometimes called the superbug because it is resistant to many antibiotics. So a lot of times when you have MRSA and they treat it with antibiotics, a lot of times you find that it really doesn't kill it, and so you have to take other means of doing something else. Red clay is good to work with MRSA, and I've got testimonies on that. I have got testimonies on folks that had rosacea, that had bumps on their forehead, that had ganglion cysts on their wrist, on their feet, and on their rear. And they were able to work with this, and it took care of it. And I'm not going to say that it happened overnight. I'm not going to say that it happened within a month. Sometimes it takes 6 months. Sometimes it even takes a year. But if you're consistent and you keep doing it, for those folks that did it, the nose was all cleared, the face and rosacea was all clear, the candida was less and less in the body, the skin disorder got better. If you had any problems with your scalp, the growth, some people have the growth on here, some people have growth here, some people have the growth on the top of their heads, and anyway, it took care of it. But and everybody kind of shows it in a little different, in a different way. Also, in working with fungal nail, fungal on your toes, also in working with athlete's foot, by soaking your feet with the clay, it tends to help with that. And the clay can be put in anything. You can put it in a little bit of water. You can put it in with your protein drink. You can put it in with juice. You can even with milk. And but for anybody that wants to cleanse, they can actually do it all by itself. Wait a few minutes and then do your breakfast. Also, in detoxifying, the acid reflux, it helps with that as well. It is said that it neutralizes the overacidic situation in the stomach, and also it changes your taste buds. So the more and more you do this, the more it tends to change your taste buds so that you end up consuming more water in order to flush, because that is what you crave. It says in detoxification, it gets rid of mercury, toxins, heavy metals, arsenic, aluminum, and aluminum is what causes mental disorders, and chemicals, PCB, formaldehyde, radiation, and that's another thing. The same way that our iosol, like the iodine, cancels out radiation, clay does the same thing. And those are two things that kind of work in similar ways. So it's always good to have clay around. Lithium is also a biopolar medication, and it's which calcium, red clay, will most likely bind to. And so a lot of times if you're taking medication, you have to take it 2 hours before or 3 hours after. So anyone that's taking medication, you have to consider and really abide by those rules so that you get the best out of your medication. The bone loss, it says building bone strength. We need calcium, however, along with not, calcium alone will not build strong bones unless it is taken with adequate amount of magnesium. It is said that boron and plenty of silica in the natural form, and vitamin D and exercise. Magnesium must be present to break down the calcium so it can be properly assimilated. If you don't have the required magnesium, the calcium is not available to enter the bones and usually builds up as calcium deposits like kidney stones, arterial plaque, and gallstones and arthritis. It is said too that calcium deposits cause kidney stones, and anyway, it's kind of painful. So a lot of times we talk about the red clay doing it. Lemon also dissolves them as well. Restless legs and muscle cramps, the same principle. A lot of times people take a lot of calcium, but they don't take enough magnesium, and so without the magnesium, you end up, that calcium just sits and doesn't do anything, and so you end up with cramps. So the idea is that you need to, actually in parts is that you're supposed to take more of the magnesium than you do the calcium, and you have to include the vitamin D with it as well. And what seals it is the silica, and the silica is in the clay. The clay is actually an 8.3. It's actually an 8.3 pH. It's actually a 3.3 microns particles. It is it's 60% of the minerals, and it is 55% of the silica. And so all that's in the clay, negative charge, helps with acid reflux, and it helps you to detoxify. One of the things that it is said is that when you start taking the clay, you don't want to take the clay where you up the dose too quickly, because it will constipate a person at times when it's starting to clean too much. The idea is that you want to take the dose like maybe an eighth to a quarter, and then increase it to a half a teaspoon, and that you do 3 times a day. And it's easy done. It's like, and the more you do it, the more you have a sense of, you'll get to see it in your urine, you will get to see it in the stool, and once you do that, it actually helps with hemorrhoids. It will heal the lining of the stomach. It'll help anybody with diverticulitis, anyone with irritable bowel syndrome, Crohn's disease, anything that's intestinal, leaky gut, the lining of the stomach when it's affected. When the lining of the stomach is affected, it's painful. And how you know it is this. A lot of times when you take medication and you say to yourself, oh, I took that medicine, oh, my gut hurts. It's like you have these really piercing pain. And that is due to the lining of the stomach that's been affected from the medication that you have taken. So the idea is that the more you take the medication, the more it strips the very lining protective. And so by taking the clay, it'll start repairing that very lining. And the idea is that in correcting that, it's, and I know because I had a lady that had that issue, and I worked with her for a year. And she said to me, every time she would call me, she would say, oh, my stomach, and I do what you said, and my stomach is not good yet. And I kept doing different things, and but I had her doing clay, I had her doing probiotics, the digestive health, I had her doing the healing tonic, but I didn't realize she was still taking the medication. And so the idea was that we started to realize it got to a point there where she just said, I think I get it. She said, I think it's my meds. And all of a sudden, but she said, I need it because my arthritis is so bad. But the longer she stayed with the program, the more and more she started taking maybe some herbal pain inflammatory herbal product that we had. And it took her a year. Correcting it is that she takes no medication now. Her stomach is good and she's good, but it took her literally a year before she was able to take herself off of all the bad and really continue to implement the very good. Today she takes no meds. There was a time she couldn't get up out of bed, and today she's all good. And these are the calls that I get. It does take time, and if you have patience and you continue to do the work, it will turn around. Just realize that the more and more of the chemicals, of the drugs, of the medication that you're taking, see what the side effects are, and then realize exactly why it is that you have a condition or a side effect that has caused. And but anyway, for anybody that suffers from E. coli, the same thing. It says MRSA also. It says that the clay has a positive benefit from dealing with E. coli and MRSA. Perhaps if we eat small amounts of premium calcium red clay daily, we can stay healthier. It is said that that's the flesh-eating bacteria. It says that, we can talk more about that. For the gums and teeth, it says brushing with the clay after flossing, and that will, you get rid of gum disease. And gum infection, I got testimonies here too. For anybody that has crown replacements or, that are irritating their gums, they can use the clay and it'll help in reducing the inflammation. You can do it as a facial. It is said to take the clay with a little bit of mixture of water. It says to have it so it's a consistency of a peanut butter consistency, and then you spread it on the skin, let it dry. You let it dry completely and then you rinse. Let's see. The clay, there is a clay that's used for baths, the particles on that is a little bit bigger. And so, for anybody that wants to know a little bit about on this research on this clay that kills the bacteria, we have that paperwork on that. And okay, it also okay, we talked about that. Okay, on the basal skin cancer, it you can work with that as well, and also that is done in a little, in mixing a little bit of the clay and putting it wherever it is that you have the condition. You can also do the gauze in places that you would have it. The clay also contains a lot of iron. And a lot of people say, well, I can't do iron, but it's from natural source, so it's good to consume it. It also says that, let's see what I didn't cover. Periodontal, it helps with candida, it helps with osteoporosis. Let's see. It helps in removing parasites. It actually it gets rid of hemorrhoids. It gets rid of hemorrhoids. It gets rid of anyone that has had surgery that has an ongoing diarrhea effect. By taking the clay, it'll start to normalize them. And, you know, there was a time back, this was, I think, in the 80s. There was a guy that actually had lost a lot of weight, was very, very sick, couldn't gain weight. He was like 6'4", and I think he weighed about like 140, and this guy was like 6'4". And, but anyway, he was like a stick. And his legs were just skinny. And the doctor had, the father had taken him everywhere throughout the country to see different doctors. And they couldn't find out what was wrong with him. And he started to take clay. It was one doctor in a foreign country that he had stayed in the hospital, and the doctor started to give him clay, and clay was the one that brought him back. And he had his mother take a picture of him, and his mother didn't want to take that picture because she said he looked so thin and so frail, but he wanted the picture to be taken, and but he got himself healthy. Clay was really what brought him back, and it's the dirt of the earth. And people in the farm knew about this. For anyone that had parasites, they would take care of it this way. You know, and what's old is new again. It's all coming back. All these different things, all these different remedies, and all these holistic means of how people, you know, back in the day, they didn't, they lived out on the farm. The nearest doctor was so far away that you know, they couldn't, and they didn't have a means to get to, so a lot of times they had to do and fend for themselves. So and most of the time that's why a lot of them died, and it was well because they didn't have you know, a chance to be able to get to see a doctor. But it is said that clay has taken has been used for a lot of years, and it has been said that the same way that we bathe and we go in the ocean, it is said that we put mud on our skin when we have a disorder, and we go and we just start packing our bodies with you know, mud and clay, and just stay there until it all dries. And so the idea is that that is what the clay does. It says there are no side effects to it. The only thing that it does is that a lot of times if it's working in cleansing too much, if the job is too big, a lot of times you get constipated. That's why they say to take more magnesium. And by taking more magnesium, it helps in so that the clay is then removed. It is said that you can give this to animals. You know, animals do get ganglion cysts as well. Now, I want to talk about a little bit the difference between uh, a ganglion cyst and a comparison to a cyst, and they're different. One can become cancerous, one does not. The ganglion cyst is actually a mass that is a fluid that's almost like a thick gel, and it is formed, and the body kind of creates like an appendix in the joint due to the fact that it's either injury prone from an injury, or the fact that the body's too acidic, and it creates that in order to push whatever it is that's toxic to that area away from the body, protecting the body. Now, a cyst is different. A cyst that is more internal, we don't get to see, and if we do get to see, it's maybe a growth that's here close to an organ, or sometimes it's more internal. Women get it in the ovaries, or and it grows in different areas. Some women get it in the breast, some get it on top here, and so everyone, and those can, untreated, if it's left alone, it will continue to grow, only because the body will continue. When the body's at a certain acidic condition, it will start to feed, because that is what feeds, the body is what feeds a cyst or a tumor. So the idea is, if the body's acidic, it will continue to feed that cyst, and that tumor will start to get bigger and bigger. And so, so much so that a lot of people won't notice that they have it until it starts to surface, and they start to see that, they look down and they see this, something is bigger than the rest of them, and they feel it and it hurts. And that is a way of people saying, okay, I got this, I better check it. And when they go in, it's exactly what they thought. And so those are the difference. A ganglion cyst, you can leave it be. You can work with it in removing it. The only thing that a ganglion cyst will do is it will get hard the longer you have it. Within time, it'll be uncomfortable because it'll start to push on maybe a nerve. Or maybe depending on where it's at, it might be uncomfortable. But the idea is that unlike the other one can be cancerous. And so that's the difference between the two. But I did want to say that clay comes in tablets as well. And I often say that the tablets are good, and it's an easy format when you're at work, so that you end up consuming it and not forgetting. However, if you're doing it for these other different conditions, especially on the feet, because when you can pack the clay in doing the little mixture on the feet and gauze it and leave it and not wear shoes, and so that those areas on the toes and stuff will heal. But the clay in the powder is a lot better. It's a better buy, and you have it longer, and then everybody can use it. The minute you mix it, you drink it, it's like it goes further. It delivers better. It affects everything. When you drink it, it affects your mouth, your teeth. It affects there's people that get ganglion cysts in their nose. I knew a lady that had a ganglion cyst in the nose, so much so that it was sticking out of her nose, and she couldn't breathe. It actually, she had to keep her mouth open because she couldn't breathe from her nose. And she started working with our products, and it does take care of it. The one thing that you have to remember is that these things are formed by an acidic condition, and the only way that you're going to detoxify the body is with high counts of minerals, and clay has a count of minerals and pH that is 8.3, so clearly it's going to affect that. For anyone that has sty, that has ganglion cysts, that has periodontal issues, that have hemorrhoids, that have intestinal issues, that have Crohn's, irritable bowel, diverticulitis, any of those disorders, any skin, candida, skin disorders like psoriasis, eczema, itchy, red, the clay is amazing. And you know, it is said that MRSA is one of the things that is the hardest, it's the worst bacteria to rid yourself of, and yet we have testimonies that the red clay will take care of. But I hope that I have answered or that I've talked about all, you know, of everything that that is good with the clay, and that anybody that would want more information, we're going to have these these pictures shown, and you'll get to see them. So realize that if you see any of these disorders on yourself, know that there is a remedy. There's a remedy for it. And anyway, let me see. Okay, it says on here, let me cover this. It is said, why do ganglion cysts appear? It says, what causes them? There is no clear-cut answer as to what causes them or why they form. The general assumption is that they're caused by injury or overuse of joints, such as might be the case with athletes, gymnasts, tennis or golf pros, yoga instructors, even typists, pianists, to name a few. But everyone who overuses a joint ends up with a ganglion cyst. That's pretty scary. And it is said that many theories includes that wherever the injury or stress spot is, toxins start collecting, building up in that area, sometimes crystallizing and becoming hard, forming lumps. Yeah, there was a time that we would see that, and we just thought that it was that we bumped our hand or bumped our foot, and we didn't think much of it. Today, now we know better. It is said too that that there are folks get fissures and stuff after surgery. The clay tends to help with that. And I'm just trying to remember all the different things maybe that I didn't, that I forgot. And sebaceous cysts, and I think we covered every dental, sluggish bowels, facial, spider bites and snake bites, and that you can do that with the bath. We have like the soap mineral bath and neutralizer, where you take both the miracle soap and neutralizer and you bathe, and you can put the clay in there and soak, and it is said that it'll draw the sting so that the swellingness will go away. It is said that a lot of times kids will get, they'll either eat something and they'll get an upset stomach. By doing clay, it's another way of taking care of that. Clay, actually, with the high minerals, it detoxifies right away. It also says there's another bacteria, the MRSA bacteria. It is said that it's the same bacteria which causes tuberculosis and leprosy. And this is the information on where it says that the clay is the one thing that eats away on toxins. on the bacteria, and it says that it eats away at the skin. This is like the MRSA that eats away. It's like ulcers or pimples, which produce toxins that eats away on the skin and muscles, destroying the soft tissue. It says the toxins overwhelm the immune system respond, allowing it to spread all over the body and down to the bone. It is said that this happens in Africa, in Asia, and other tropical areas of the countries where disease is more prevalent. And clay is one of the things that is used, and in doing so, they rid of that. There's certain bacteria that can kill certain bacteria, and MRSA is one of them, and the clay can do that. I think clay can be used for scalp, for brushing your teeth, for doing facials, for doing topical, for doing a palmist where you put the gauze. It's best to put the gauze on there so that the clay sticks to that, and it stays there longer. And the longer you have it there, even though it's dry, it'll continue to draw the very toxins. It's kind of the same way that we use the Palma Christi oil in doing it with heat. But anyway, for anybody that would like more information on the red desert clay and the very benefits that you can get from, oh, and I was going to say too that a lot of times pets suffer the same way as people do, and the pets, you can do the same thing. The pets, you can actually take and do give it to them in their food mixture. They don't even know that they're consuming it. And if and when your pet has issues with diarrhea or has stomach inflammatory condition where they keep going, you can give them clay. Or if they have a growth, dogs and cats seem to get into everything. So a lot of times they'll get around their neck and stuff. They tend to get this big mass. And but by giving them clay, it actually softens, and it helps to reduce all that acid buildup that is in certain parts of them. And by doing that, it'll keep them healthy. But it doesn't change the taste of anything. They eat the food, or you can put it in their water and they'll drink it. And the clay doesn't taste like anything. It changes the color, and it's soothing when you drink it. It's very soothing. It doesn't taste bad at all. So for anybody that would like more information on all that we talked tonight on the clay and for all the benefits, you can call us at the 651-486-0525, or you can log in to our site at greershealth.com. I wanted to read this testimony here on the study that was done in Tempe, Arizona. The healing powers of clay have long been the stuff of lies and legends. Literant merchants called it a cure-all historical reference. Go back centuries, and in the Bible, Jesus mixes it with spit to cure a blind man. New Arizona State University researchers say clay may indeed be the miracle dirt capable of killing deadly infections. They just don't know how it kills bacteria, a missing link that must be found in medicine must be found if medicines are to raise from the mud. Finding from 2 years of research from geochemist Lena Williams, microbiologist Shelley Hayden, were presented Sunday to the American Chemical Society meeting in New Orleans. Their work was financed by the National Institute of Health. The two researchers collected the studies more than 30 types of clay from around the world. They placed the soil in petri dish with bacteria that presented major public health threats. Most of the clays had no effect, but 3 were found to kill or greatly reduce the bacteria responsible for such dangerous infections as MRSA, E. coli, and Salmonella. We know they kill bacteria, but we don't know why, William says. It says we haven't had that yet. William says she became interested in the medicinal potential of clay 5 years ago after learning about the experience of the line Bernard de Courcelles, the late French humanitarian working on Africa's Ivory Coast, reported in 2002 that poultice of imported French clay destroyed the leprosy-like microbials of Barrett's ulcers in 100 patients, subsequently dressing with a second clay enhanced healing. Williams says she was not surprised that the clay can be beneficial. The cleansing properties of mud baths are well known, and geologists who get cut while working in the fields often treat a wound with clay because it stems bleeding and absorbs toxins. Mud was used on the wounds of the World War I soldiers. It has been consumed as a palliative by some indigenous group and by pregnant women in Appalachia. It says, but the bacteria-killing properties of clay remain a mystery. Hadel says that trio of clay identified as antibacterial are not uniform in chemistry or color, and the microbials they kill are dissimilar in structure and genetics. The researchers are seeking another NIH grant to finance their efforts to find practical applications for their findings. They hope to come up with a cheap, accessible cure for deadly infections worldwide. This is the study that was done in Arizona. So for anybody that wants to know more or just read that, we do have it. I also wanted to say that I didn't say this before, but for anybody that's taking antibiotics, they say that it says stop eating clay while taking antibiotics, but take probiotics after completing a round of antibiotics to replace the beneficial flora. Birth control pills, they say too, it says clay might interfere with the absorption of birth control pills. So for anybody that's doing this kind of thing, know that, yeah, they can affect that. So you have to kind of, but you can ask us and we'll let you know exactly how to take it and what time of the day or how far between. I know that our liquid vitamins, we have to do that. We tend to have to take it either an hour before or take your medication and then, or take it 2 hours after. You can't do it in the same because it's too dense, and so the clay is similar to that. It cancels out the very thing that, you know, on medication. But anyway, for anybody that would like more information, you can call us at 651-486-0525, or you can log in to our website at greershealth.com.